Hi everyone, I'm here again. I just received a wonderful message from a friend being shared on Facebook, and it's what you call a COVID-19 assessment tool checklist, and it's courtesy of Department of Health Philippines. So without further ado, I would like to share it with you. Okay? It's called COVID-19 checklist, and it's based on the point system. Score 1 to 3 points for each question. So the symptoms are as follows. Do you have cough? 1 point. Do you have colds? 1 point. Are you having diarrhea? 1 point. Do you have sore throat? 1 point. Are you experiencing myalgia or body aches? 1 point. Do you have a headache? 1 point. Do you have a fever of temperature 37.8 degrees and above? 1 point. Are you having difficulty breathing? 2 points. Are you experiencing fatigue? 2 points. Have you traveled recently during the past 14 days? 3 points. Do you have a travel history to a COVID-19 infected area? 3 points. Do you have direct contact or is taking care of a positive COVID-19 patient? 3 points. For a total of, ta-da-da, well, the score results varies. If it says 0 to 2, it could just be stress related and you just have to observe, nothing to panic about. If it is 3 to 5, you need to hydrate properly and a proper personal hygiene, of course. You might just be having a mild infection. So you need to observe and pre-evaluate after 2 days, okay? When the score is 6 to 12, you need to seek a consultation with a doctor, okay? You might be a borderline. When the score is 12 to 24, you need to call the helpline. So if you're in the Philippines, obviously the Department of Health, and the number is 028 651 7800. If you live in the UK, then you have to call 111, which is the out-of-hours GP surgery or your own surgery, wherever you are registered with. You need to declare how you feel as based on this assessment tool. If you are located in Dubai, UAE, or any part of the world, then hopefully you will be contacting the recommended hotlines, a number to report your case. So world, if we all work together and if we declare ourselves, be open, transparent, and be honest about how you feel, how you assess yourself, then this is the fight that we can stop the virus and we can be victorious. So good luck everyone, and happy assessing. And I hope get well soon. Stay safe. Universal hand washing, self-isolation, eat healthy food, drink a lot of fluids, hot drinks, especially, and just be clean all the time. Continue spraying, washing, cleaning, and social distancing. Okay? Stay safe. Until then, love you. Take care, everyone. We're gonna beat this virus, I'm sure. We're gonna win it. Take care.